This is our long-term strategy, and we're going to head there together. That's how it has to be.
I thought that was normal. I thought going to a group placement is one of the effective steps to getting you to where you need to be. But also, when you take the time to sit down and think about how it impacted you, and I've done that with this, it wasn't good.
Having these intentional conversations with residential treatment facilities, and they would ask the young people, what is something that you want to see change, or what's something that you would want to hear implemented in the system. And so I had a young man by the name of Jake Paul McKinley, who unfortunately we lost this year to gun violence, and his response was, we need love, we need unconditional love. And so that always stuck with me.
About 10 years ago that we started learning about creative new ways to work with inside systems that can often be rigid and struggling to think about new ways to serve kids. And as we learned these new practices and new ways that providers had effective strategies to serve folks differently, we took that as a moral imperative. We said, if we know that there is a better way, we now have a responsibility to change our behavior.
We took data from kids in our wraparound program and data from the residential program, and really identified that these are the same youth, and they could be managed safely in a home if you put the right supports around them. So then we started reducing our residential footprint.
As a community provider, when we think about the role of the local Department of Social Services, they play an essential role in ensuring child safety, making sure that children and families have what they need to be successful. But when families are accessing the local Department of Social Services, whether intended or not, there's fear, there's stigma, there's a variety of things that are associated with accessing those supports. The benefit of tapping into a local community provider is that through a meaningful partnership with the Department of Social Services, we can connect with a resident in a voluntary capacity, where they are able to reach out, identify their needs, and collaborate with us in identifying and navigating where resources exist. I think that the partnership between the local Department of Social Services and a community provider is the secret sauce, but both have to be on the same page. Both have to understand their role.
With SanMar specifically, we were calling each other every day and helping them. However, I also hold out that same help to all the others. And we had, I would call them learning collaboratives with all the Western Maryland providers. We did video town halls, and I invited the Mental Health Authority to explain how they could stand up their current staff as treatment providers and how to become Medicaid reimbursable.
We have an integrated core practice model that has all of the wraparound values in it. And so we all want that, but we can go talk to each other when we're not hitting that target. And that makes it, a better outcome for our youth. Even if we disagree, we still have a strong enough relationship where we can still be agreeable.
As opportunity presented itself with the passage of the Title IV waiver in the state of Maryland, the local Department of Social Services and SanMar came together and started to explore opportunities to collaborate to support proactive and preventative family services. SanMar had been on this journey for a couple years doing this internal soul searching, so the timing was great because we were ready as an organization to respond to an opportunity that the state of Maryland and our local county social services agency was considering implementing as they thought about how to best allocate their resource.
We've been on a journey for quite a while, but we've partnered with our public agency, and for us, that's Department of Children and Family Services in Los Angeles County, Department of Mental Health, Department of Probation, and then also in Riverside County as well, and then also with our state. And there's alignment around how to do the work. and what's most important. And what's most important is keeping families together.
You're in a community with other youth who have shared experiences, but their traumas and their stories are different, so they may not. It just looks very different depending on the circumstance and the story. And of course, living in those type of environments, you're impacted by it all.
We also advocate for our youth in court. So we're supposed to be a part of the treatment meetings. We're able to sit and talk with the lawyers and be a part of their discharge meetings. So that's another thing that's a game changer, having someone who you can really feel comfortable with supporting and advocating for you. What we do here is a lot of advocating.
We can make this work if we have the intention. We can help providers retool and move forward in a healthy way, or we can let them languish, and then we can thump our chest and say, oh, we don't have what we need. Why don't we have what we need? And to me, it's more about intention and will to get the work done rather than we don't have the resources. We have resources when we want resources.